Welcome to the Inhibitory Techniques presentation. The purpose of this presentation is to provide the health and fitness professional with the knowledge and rationale for the use of self-myofascial release as an inhibitory technique within a corrective exercise program. Following this presentation, the health and fitness professional will be able to understand and explain the rationale for the use of self-myofascial release techniques, be familiar with different self-myofascial release modalities and their uses, and apply self-myofascial release techniques to assist in inhibiting overactive myofascial tissue. As mentioned in previous presentations, corrective exercise is a term used to describe the systematic process of identifying human movement system impairments through an integrated assessment process, developing an appropriate plan of action based on the impairment or impairments, which is accomplished through integrated program design, and then implementing an effective corrective exercise strategy with an emphasis on proper exercise technique. A corrective exercise program will involve up to 4 primary phases, known as the corrective exercise continuum. The first phase in the corrective exercise continuum is to inhibit. The term inhibit refers to the process of decreasing overactivity of the neuromyofascial tissues that contribute to human movement impairment. The primary inhibitory technique that will be utilized by the health and fitness professional and that will be discussed in this presentation is self-myofascial release, which is typically performed with a foam roller. Self-myofascial release. Self-myofascial release can be used for 2 primary reasons. The first is to alleviate the side effects of active or latent trigger points, or knots, within the tissue. Trigger points are hyperirritable and often tender areas of muscle tissue that can cause either local or referred pain to other parts of the body. They may develop as a result of acute or repetitive microtrauma and stress to the soft tissue system. The second reason is to influence the autonomic nervous system, which is the component of the nervous system responsible for controlling the heart, blood vessels, and other visceral organs, as well as causing the release of certain hormones involved in energy metabolism and cardiovascular functions. By influencing the autonomic nervous system, self-myofascial release reduces the viscosity of tissue, decreasing global muscle tonus, and smooths muscle cells in fascia that may be related to the regulation of fascial pretension. When performing self-myofascial release, the external pressure exerted on each body part by the foam roller and the weight of the body stimulates receptors located throughout the muscle and connective tissues that send information to the central and autonomic nervous systems. These receptors, such as the Golgi tendon organ, interstitial receptors, and Ruffini endings, have been associated with producing an inhibitory or relaxation response to the muscle due to sustained pressure and/or tension by inhibiting the muscle spindle. The practical significance of self-myofascial release is that by holding pressure on the tender areas of tissue, such as in the calf complex shown here, for a sustained period of time, trigger point activity can be diminished and relaxation of the muscle occurs. This will then allow the application of a stretching technique, such as static stretching, to further increase muscle extensibility of mechanically shortened muscles and provides for optimal length-tension relationships. Key points in utilizing self-myofascial release. There are a variety of tools to utilize in the application of self-myofascial release. Tools will have varying effects depending on their size and construction. For example, those made of softer, less rigid materials will have an effect on more superficial layers of the fascia, while tools that are harder and more rigid will increase pressure on soft tissue structures and access deeper layers of the fascia. Some examples of self-myofascial release tools include cylindrical rollers, balls, handheld rollers, instrument-assisted tissue mobilization, and vibration and percussion devices. No matter which modality is used, there are a few key application points one must consider. 1. Make sure the client maintains proper postural alignment while performing self-myofascial release. 2. Instruct the client to maintain the drawing in maneuver, or pulling the navel in towards the spine at all times to provide stability to the lumbopelvic hip complex during treatment. 3. The client may use their extremities to alter the amount of weight on the treatment area in order to decrease or increase pressure on the soft tissue. For example, When foam rolling the calves, the client may cross the free leg over the treated leg to increase pressure, or keep the legs uncrossed to decrease pressure. 4. The client should roll slowly over the treatment area. They should not roll over the areas quickly to decrease the risk of further tissue excitation. Remember, we're trying to inhibit the overactive tissue. 5. Instruct the client to relax and not tighten up while working on an area. Tension in the tissue being treated will prevent the roller from penetrating into the deeper layers of soft tissue. 6. Instruct the client to pause the rolling action over painful areas until they feel a release in the area or the pain subsides and the tissue softens. Roughly 30 seconds with maximal pain tolerance and 90 seconds for lower pain tolerance. And 7. Areas that have myofascial restrictions will be more painful to mobilize. As soft tissue restrictions break down with subsequent sessions, treatment will become less painful. Program design. In addition, there are instances in which performing self-myofascial release can be contraindicated. Anyone using self-myofascial release techniques should follow the same precautionary measures as those established for massage and/or myofascial release. As is the case with any form of exercise, an appropriately licensed medical professional should be consulted for further information and direction. For example, self-myofascial release should be cautioned or avoided by people with congestive heart failure, any organ failure such as kidney, liver, or pancreatic failure, bleeding disorders, and contagious skin conditions. Refer to your text for a complete list of contraindications. To be effective, self-myofascial release must follow sound acute variables. At the current time, there are no known reasons that self-myofascial release cannot be performed on a daily basis. This is the current practice of NASM with apparently healthy individuals. However, this will ultimately be determined by the client, any possible precautions that exist, and the advice of a licensed medical professional. 1 set per noted body region or muscle group is sufficient. If using a foam roller, one should hold the foam roller on the tender area for roughly 30 seconds at high intensity or maximal pain tolerance, or approximately 90 seconds for lower intensity or minimum pain tolerance before moving to the next region. Please refer to the exercise video library for examples of self-myofascial release techniques for different muscle groups. Summary. In summary, self-myofascial release is the primary inhibitory technique used in the first phase of the corrective exercise continuum. Self-myofascial release is used to release tension and/or decrease activity of overactive neuromyofascial tissues in the body. This technique will help prepare the necessary tissues for the next phase of the corrective exercise continuum, lengthening techniques.